All right, everyone, welcome. Thank you so much for joining us today. This is our June event of our e-learning series. It's the final event of a series we've been running on youth or young people in community-based research. And we're stretching this definition of youth in this presentation as we look at a research study on the quality of life in young adults diagnosed with cancer and how this research study has used community-based methods to engage young people within their research. For those of you unaware of us, this presentation is brought to you by Community-Based Research Canada. Our secretariat is located on the traditional territory of the neutral Anishinaabe and Haudenosaunee peoples in what's known as Waterloo, Ontario. We are a membership-based organization with a mission of advancing community-based research excellence in Canada by strengthening partnerships, building capacity, mobilizing knowledge, and championing community-based research among individuals, communities, and institutions. We are a social enterprise. We're funded by about 50 different institutional members at this point. And we host events for our members, such as these e-learning events, as well as live discussions, community of practice, and training opportunities. As part of our commitment to continual reflection on truth and reconciliation, each of our e-learning events, we highlight one of the calls to action in the Truth and Reconciliation Commission of Canada. Since today's event, we're talking about quality of life and health and healthcare issues. I wanted to highlight call to action number 22. We call upon those who can affect change within the Canadian healthcare system to recognize the value of Aboriginal healing practices and use them in the treatment of Aboriginal patients in collaboration with Aboriginal healers and elders where requested by Aboriginal patients. At Community-Based Research Canada, we are committed to ongoing and continual reflection on the interconnections between truth and reconciliation and the various topics that we address using community-based research approaches. So today's event, I'll be passing it over to our presenters shortly once I'm done my little introduction here. Our presenters have a 20 or 30-minute presentation to give us where they'll be sharing about their research project and how they've engaged young people and individuals with lived experience within their research project. We will have time for question and answer after that presentation. I highly encourage folks, if you do have questions, things that are coming to mind for you, please ask them through the chat box at any time during the presentation. After the presentation is concluded and we get to the question and answer period, I'll scan the chat box to see which questions have come in, and I'll facilitate a discussion around any questions you have with our presenters. So please, again, feel free to enter your questions at any time during the event, and we'll get to them when we get to our question and answer period. We do ask that folks keep their microphones off just to prevent any background noise as our presenters are presenting. You're welcome to have your cameras on or off if you would like, particularly in the question and answer period. When we wrap that up, we'll do a quick closing to our event, and this will also be our goodbye to you until September. We do take a break in our programming over the summertime. We're very excited for this final event to wrap up our series and to introduce to you, give you a sneak peek during our closing of what topic we'll be tackling in our next fall series. So without further ado, I will introduce and pass things off to our presenters. With us today, we have Pam Crotty, the Senior Research Manager of Young Adult Cancer Canada. We have Danny Taylor, Manager of Programs and Partnerships of Young Adult Cancer Canada. We have Carolyn Van, a team member of the Recover Study leadership team that we'll be hearing about today. We have Elisa Dickey, an Insight team member with Young Adult Cancer Canada, and Jeff Eaton, the founder and executive director. So we will hear from each of these folks about their experiences. We'll learn about what this recovery study, what the leadership team and the Insight team have, what roles they've played within this project. And I'm very excited to be passing it over to all of you.
Thank you, Amanda. There you go. There's our next slide. Thank you so much, Amanda, for having us present today about the Recover Study. I'm very excited to let you all know what we've been up to. As Amanda said, my name is Pam. My pronouns are she, her. I have straight, medium brown here, and an olive complexion. I'm wearing a black shirt. I live and work and play in Calgary, Alberta, which is located in the heart of southern Alberta. So I acknowledge and pay tribute to the traditional territories of the peoples of Treaty 7. I'm also a mom to a 6-year-old daughter, and today my role in this presentation will be as the Senior Research Manager at Young Adult Cancer Canada to tell you all about the Recover Study. Next slide, please. So this is the agenda that we'll go over today. We already kind of went over brief introductions, but as each speaker goes through, they'll give a more detailed introduction to you today. Jeff will give a background on Young Adult Cancer Canada, which we affectionately call YACC. And Lisa will speak about the Insight Team. Danny will give some of the origins and background of how the Recover Study came to be. And I'll speak about the actual procedures of the Recover Study. And Carolyn will go into the leadership team development and overview. Next slide. So once again, this is pictures of all of us, but I think you can see all of us on the slides. And as I said earlier, we'll all give you a deeper introduction as we go through. Next slide. And I'll actually throw it over to Jeff. He's our Executive Director of YACC.
Awesome. Thanks, Pam. Jeff Eaton, two-time young adult cancer survivor, and I am the Executive Director at YACC right now. I am bald with a little bit of scruff on my face to make up for the lack of hair on the top of my face. I have blurry background with, unfortunately, no really exciting avatars or emojis floating across the screen. That picture on the screen is of me 26 years ago, almost exactly to the day, finishing university. Unexpected for some, but triumphantly graduating from business school. And thought I was invincible, certainly at that time in my life. And if we remember back to that time, if we have passed it, that stage of life is unique because of so many things that are going on. In my case in particular, finishing school, starting career, and hopes down the road of starting family a little later on. And this space around Young Adult Cancer Canada's work is really based on this core reality that for the young adults we serve, their life is different because of the stage of life they're in. Next slide, please, Amanda. Thank you. Because life is so different, we really, really believe and see so regularly that their cancer experience is different. Our buddy Steve Webster, a yacker from Prince Edward Island who passed away many years ago, used to wisely say that when you're just starting your life, cancer forces you to face the end of your life, and that impacts the rest of your life. In particular, our work at YACC is focused on the whole life of the patient. We're talking physical, mental, social, and financial impacts. We have a lot of focus. I would argue a disproportionate amount of our focus is on treatment. It's an incredibly important phase, but I think we've really missed most of the patient's life and their experiences. And that's where YACC tries to pick up some of the slack. Next slide, please, Amanda. We covered the cancer's different piece. Most on the call today likely have someone you love that's been diagnosed with cancer. 5, 25, or 65 years of age, anytime cancer comes, it creates a real huge challenge for the patient and those around them that love them. When we are in this young adult space, because we have such different things happening with our life, it creates unique challenges for that experience as well. And that is sometimes even more intense in the recovery phase of their life. You think about resuming work, dating, finding your way back to a social life that you love. These are some of the real challenges that our young adult cancer community face every day. The other real underpinning of YACC's work is that recovery actually takes longer than treatment. And it's a big driver behind the Recover Study that we're going to talk to you about today as well. This is a universal truth, I think, but also particularly relevant, important, and true for the young adults that we serve every day. Next slide, Amanda. I think I'm handing it over. Thanks so much. Over to Elisa.
Maybe I'll just jump in real quick before we go to Lisa. So this is just a little snapshot of another research project that YACC has been has undertaken and that we continue to do knowledge translation within, called the YACC Prime study. So you'll see here all the incredible things that we have some wonderful information on, and the team behind that within the YACC Prime study. And so from here, if we can go to the next slide, we're going to get to our origins of our next project with the Recover study. Prime left us with such an appetite to do more in this space, and the insight team that Elisa is going to tell you about was really, really huge in helping to shape our next efforts.
Thanks, Danny. Thanks, Jeff, for the intro. Let me just back up my own slides here. So as you heard, my name is Elisa Dickey. I use she and her pronouns. I wear glasses and currently have an edgy platinum blonde asymmetrical pixie haircut. I'm coming to you today from my home. And again, like Jeff, I have the blurred background because there wasn't too many fun options to choose from. What you can't see by looking at me is that I've been living with an incurable blood cancer called multiple myeloma for 14 years. I also typically do not look sick. But on this slide, I have shared a photo of me with the typical chemo look that is rocking the bald head following my second stem cell transplant in March 2018. My disease includes periods of remission and periods of treatment. I like to call myself a YACC graduate. So what I mean by this is I connected with YACC about a year after my diagnosis. I was diagnosed with cancer 6 months after I graduated from university. As Jeff mentioned, I had just been starting my life. I had just, received a promotion for my first, business management job, and then bam, cancer hit me. I was able to participate in the in-person YACC retreats, as well as several larger survivor conferences and some local support groups in my home city called Local Life. What I learned participating in these programs has stuck with me and will stick with me for the rest of my life, that I'm living with cancer. And it gave me the tools and the community I needed to navigate the challenge that comes with a long-term cancer diagnosis. Next slide, please. So what you can see on this slide, so you'll see there's a photo. It has several profile pictures. These are the initial members of the YACC Insight Team. Insight Team represents members from a diverse group. We come from different parts of Canada, including both rural and urban. We are at different points in our cancer experience, ranging from recently diagnosed to long-term survivors, and we include voices from the BIPOC community as well as supporters. We also vary in ages. As I said, I've been living with cancer now 14 years. I am currently 46 years old, so in terms of young adults, I don't think anyone touched on this. The adolescent young adult community is typically under 40, though if you're diagnosed with the cancer as a young adult, you keep that label even though you progress through the system. So we joined Insight to be a voice for our community and a community that includes every young adult impacted by cancer in Canada. YACC's Insight Team was developed with the purpose of providing personal experience, expertise, and support for the development and delivery of YACC initiatives, especially support programs, fundraising, research, and communications, and to ensure that YACC has a wide breadth of knowledge included in decision making. Next slide, please. Insight Team members, here we go. So early on at the Insight meetings, we focused on the idea of what's next for YACC, and also what's next for our patients. We explored the power of language to describe what cancer survivors go through during that later phase of cancer journey. The idea that once the treatments wind down and we attempt to pick up the pieces of our lives and put it back together again, is there a word or something that could capture this idea? This is where the idea of recovery comes in, which you'll see is the study called Recover. So in our discussions, we talked about, what is the meaning of this to us? What does this word represent to us? And the idea that there's no end point. The timeline may be different for all going through it, but experiences during this period can be shared. And this is the idea that the Recover study is trying to capture. I shared here the agenda at our September 2022 Insight meeting was basically around what a name should be. So a name for the study, what messages a name communicates. During our meeting, we even went so far as to, pull up the thesaurus, try to find a better name or try to find any other ideas that could represent or capture this moment. And we just kept coming back to this idea of recover. There didn't seem to be anything else that could fit quite so good as this. Next slide, please. As I have here written on this slide, cancer impacts every area of one's life, mentally, socially, financially, and physically. If Prime captured a moment, Recover will capture the lifetime. So this is the idea that, Prime, we were able to really have a place for our voice where we could share, what life is like when you go through a diagnosis. But then as we go through and beyond, how can we capture this? And this is where Recover comes in. And especially this is where the Insight team was able to provide feedback for the research. During our Insight team meetings, so when you get a lot of cancer patients in a room together, we always have a lot to say, and there's always certain ideas that keep coming out. This is where we have some of the main points that we come back to. This is the quality of life. What happens after cancer? Cancer impacts you, and it impacts you for the rest of your life. It impacts your family, your supporters. It's not just a person going through it, so it's important to recognize that. Fear of recurrence is something I don't think that ever goes away for anybody who has ever received a diagnosis or a loved one. Even if we don't say it, it's sort of always there in the back of our mind. Body image is huge, and if we're talking physical, fertility, and when you're impacted with cancer at a very young age, especially like your 20s and 30s, this is something that you may have not thought about or had an opportunity until that's taken away from you. And lastly, I just want to highlight is the cost. We all believe we live in Canada and it's a great medical system until you find out many things aren't covered by the system, including things such as take-at-home treatments, pills, many things like that. So, this is just some of the main sort of topics that come out at our meetings. So what happens next, the 5 years, 10 years plus, how will those issues continue to impact us? This is why the Recover study is so important. I'm going to pass it on to Danny now. She's going to talk about her involvement with Recover and how it's evolved into a community-based research project. Thank you.
Thank you, Elisa. So I have been connected to YACC for quite a while. This is Danny speaking. I use she, her pronouns. I'm a youngish woman with kind of pale skin, a round face, and I sport a pair of glasses. It's nice to be with everybody here today. So I've been connected to YACC since not too far beyond that photo that I have there of me in a hospital bed, I think marking chemo number 7. So at that time, I was in treatment for colorectal cancer at the age of 23. And it wasn't long after that I got connected with YACC for support because boy, was I struggling. I think for a lot of really, really valid reasons I was struggling. But YACC was a huge part in my recovery, which continues to this day, 10 years later. So my role within the community has kind of shifted and changed over the years from being somebody that took services, a service user, let's say, to volunteer with the organization, to now as a staff member. So in these 10 years, I've trained as an oncology social worker, and I've worked for Princess Margaret, for Sunnybrook, what have you. And then I've kind of come home to YACC in many ways. So where I was in the project when I came to it was I was kind of, I think, meant to be in a bit more of like a project management support type role. But when I came into things, we had a lot of ideas, but we were starting to run into some challenge points. There was a lot of things within the first research project, YACC Prime, that were done that to me now I understand are very much in line with community-based research, like why we were doing the research, how we were doing it. It was so collaborative, it was so fluid. And something I think that was like really wonderful and kind of lucky within that process is there was very little friction. But this time we were starting to have some stalls. We were starting to have some different opinions with some of the academic researchers at the table, particularly when it comes to our population priorities. So for the AYA, or young adult population, there's a number of different ways that you can capture that. Some journals will tell you it's 16 to 30. Others will say, no, it's 14 to 39. Others will be 18 to 45. It's all over the place. YACC, we know what we do and who we serve. And for us, that's folks that have been diagnosed with cancer before the age of 40. So that includes folks with pediatric cancers that are currently between the ages of 18 and 39-ish. And so for us, if we were going to be investing time, resource, money, what have you, in research, we really wanted it to be something that could help all of our community. So we're having a bit of challenge there. And with challenge came questions. Well, who finalizes decisions? Who funds it? Who's going to benefit from this? Why are we doing this? And I think that forced me into like a fun place of discomfort where I think a ton of learning and knowledge can come from. When I think about like how I describe myself professionally, I think research is actually pretty far down my list of things I'm comfy in. And so I had to like kind of strain and remember back to classes in university when we were talking about different research methods. And I remember usually around like the final weeks of a semester, we'd start to talk about community-based research or participatory action research. And I was like, okay, I think there's something there. And so I started to explore, and I found all these other incredible nonprofits and individuals that were doing it. And then I found the community-based like research ethics area. I was like, oh my gosh, this is a whole different road I didn't even know was possible. I found this organization that we're now speaking at today. I think I definitely sent Amanda a bunch of emails asking some very rudimentary questions early on. But it opened up this whole new world to us where YACC and our community could really be in the driving seat of this. So we were able to put together a pitch that Jeff was able to bring to our board. And this put us on a brand new, very exciting and empowering path that now Recover is on. And part of that path, a really wonderful part, has been able to bring in our own senior research manager to help bring this mission forward. And so that's who I'm going to bring us over to now. Pam, let's bring you back onto the stage and I'll go away.
Thanks so much, Danny. Thanks, Elisa and Jeff, for setting up the how and the why of Recover. So I was brought in basically to lead the research behind the Recover Study, which is a community-based mixed methods longitudinal study that seeks to engage young adults with living experience with cancer to understand the holistic quality of life, meaning physical, mental, social, and financial aspects over time, and to identify recommendations to improve the quality of life. Coming into this, community-based research was also a very new kind of way of doing research to me. I come from a background of clinical trials, so I know research processes, but not necessarily community-based processes. So over the past year, I've learned so much in involving the community and in understanding what community needs are so that we can actually formulate our own questions that will directly impact and benefit the community that is not only participating in the research, but leading the research. Next slide, please. So the objectives of the recovery study is primarily to understand the quality of life in young adults with living experience with cancer over a 5-year period. Other objectives that we hope to measure would be to explore several variables, including the socio-demographic, diagnostic, treatment, psychological and social well-being, and relationships and finances, all of the things that Elisa previously covered that are super important to young adults, and getting a better understanding of, how can we make it better? What do we need? We also want to understand the effect of our YACC programming on quality of life so that we can identify opportunities for improvement. Essentially, the purpose of our community-based research is to benefit the community by enhancing or adding programming for the community. Next slide, please. Other objectives would be to develop integrated knowledge translation materials so that we can inform our program delivery, we can advocate for change, and improve the experience and quality of life outcomes amongst young adults with cancer. In turn, we also want to build capacity of YACC as well as young adults with cancer so that they can engage in and facilitate community-based research. And that's kind of how we came to be here and how we're going to speak about how our leadership team is really engaging in the research process as part of the Recover study. Next slide, please. So the actual study procedure. So what we are doing mainly is an online survey that we are asking community members to take at baseline as well as yearly for up to 5 years. Within that survey, it's demographic questions, cancer-related questions, but then there's a series of validated questionnaires that focus on various aspects of health-related questions, quality of life, different things that would hope to help understand various quality of life issues in young adults living with cancer. Optionally, with our research, within the consent form that you do online, there are optional ways that you can provide consent. One of the biggest ones are our interviews, focus groups, and creative methods. So kind of a qualitative piece to our research that will hopefully give us a deeper understanding of some themes that come from the survey results and or themes that are actually led by community members and issues that maybe we want to discuss a little bit further that wouldn't necessarily be captured in that survey. Additionally, we are asking for consent so that we can link the survey responses to respondents to our internal YACC administrative databases so we can get an understanding if there's any kind of effect on quality of life of program attendance within YACC. We also want to be able to offer up individualized programming and outreach so that if we find some themes that people are facing within our survey results, then perhaps we can develop some programming around it so that's specific to the exact needs of our community. And we are asking for consent so that we can actually reach out to those people that would benefit the most from these programs. And lastly, we are requesting people provide their healthcare number so that we can link their survey responses to cancer registry data, so more clinical outcomes. But this is a future research study that we would ask for separate ethics applications and approvals before we actually link any data. So at this point, we're just asking for the healthcare number and not doing anything with it. I should circle back to and mention that this study was approved by the Community Research Ethics Office out of Waterloo, and I know they're very, they partner with Community-Based Research Canada as well. So just wanted to throw that out there that we have CREO approval to go forward with this research. So next slide, please. Okay, so what I'm going to do next, I'm going to pass it over to Carolyn. As part of our research, we have developed a leadership team. So that consists of community members who are really pivotal in giving us some understanding and background so that they can lead the research. So I'm going to pass it over to Carolyn so she can give you a better understanding of what we do.
Thanks so much, Pam, and thanks everyone for joining us. This is Carolyn speaking. I have medium length dark brown hair, and I am streaming from Toronto, Ontario. And yeah, it's an honor to be here with everyone. So unfortunately, my initial connection to YACC is also a personal one. As a program participant, at 28 years old, I was experiencing all the things that a normal, healthy, energetic 28-year-old does. You know, those initial career milestones, a very active social life, feeling invincible, mentally, physically, emotionally, in all the ways. Forming new relationships and doing lots of travel. And then I was blindsided by this atomic bomb that was the big C, which significantly impacted virtually every aspect of my quality of life. But, you know, it's 2024 and I'm definitely in celebratory mode. It's my 10-year cancerversary of the triumphs from the past decade and 10 years of truly gaining some superpowers that I get to apply every day in my personal life, in my professional life. And with that has come, you know, getting to know the new me, the version 3.0 of Carolyn. And, you know, it was my experience over that decade that really allowed me to observe some of the gaps, the breaks, and of course, the opportunities that lie within our systems and our communities. Next slide, please. And, you know, I would say that over the past 10 years, my involvement with YACC has been multifold. So participant, volunteer, consultant, conference guest. And so when this call out was made in September 2023, around wanting to call in folks that could help guide the direction of this Recover study, myself, along with 40 plus other people from all over Canada, threw their hat in, expressing their interest to be a part of this, five-year study. Next slide. So this resulted in 7 individuals to help guide, temperature check, and validate the efforts along the way throughout this study. I think something that is so awesome about this group is that we come equipped with a diverse range of professional experience and expertise that where we've made ourselves available on a volunteer basis, a couple to a few hours a month. I will say that my personal motivation in helping wherever I can over the past 10 years, and most certainly with this study, is truly wanting to create a better future for those even far beyond my time. When I'm gone, you know, I'd like for those in the future to be able to look back at 2024 and be astonished at how organizations like YACC was able to achieve what we were able to with what we have, and also feel a sense of relief and gratitude that they have a far better and more accurate understanding of the needs, challenges, frustrations, motivations from those impacted by young adult cancer. So yeah, I want the future version of us to look back at 2024 and almost kind of be not embarrassed, but amazed that we were able to do what we were able to do with what we have. You know, with the point being, you know, better equipping the future with better tools, frameworks, and so forth. Next slide. These are the other team members. Of course, I'm only one of 7. There's the opportunity to get to know the other 6 as well. I also want to share that I think this type of work, and I'm sure some of you know that are here joining us, that it's very much so a long game, right? And you know, it's not easy work all the time, but I think one of the things that keeps me here and keeps me motivated is knowing that it's possible. Some of my professional works is proof that it is possible to design and deliver evidence-based programming to once upon a time underserved, underrepresented, marginalized groups and communities. And with all of that amounting to impact that is measurable and scalable, that other organizations can truly learn from. So because and again, all of us have different professional experiences, but my professional work tells me that it is possible because it's been done. So again, I'm only one of 7. You know, we're a bit of like an Avengers crew. There's different talents. We represent different stages of our personal lives, different experiences and relationship with the big C, with cancer. So again, feeling honored to be a part of the team, and you can get to know the other folks on our website. Next slide. So as I mentioned earlier, this work is a long game, right? And I think that whenever we're working on something that is in it for the long game, it is important to acknowledge some of the wins along the way, right? No win is too little. It all adds up. And it all counts. So some of the wins, although we're only a few months in, some wins that are I think are worth acknowledging is that there was an influx of interest to lead. Again, I was only one of 40 plus applicants that expressed interest to take time out of their schedule, whether that be family life, full-time work, schooling. So more than 40 of us raised our hands expressing interest, which I think is worth acknowledging. It resulted in 7 of us with diverse skill set, cultural backgrounds, living in different provinces across Canada, different stages of young adult cancer impact. We are also, in the spirit of transparency and allowing for people to come along for the ride, come along for the journey, we have been publishing behind the scenes summaries from our leadership sessions. Any day now, I think a write-up from yours truly is going to be published on what went down in May. So if you want to check out the YACC website under news, that should be coming up, but you can see our past few months as well, written by leadership team members. We want to give the assurance and provide the confidence to our community members that things are moving. We want to provide opportunity for community members to contribute and know that things are certainly in motion. We are also sharing in progress study updates on the latest. So we have emails going out that share some data on where we want to go and where we are to date. Again, in the spirit of transparency, that's a piece that's important to us. And of course, by having these leadership team members like myself, we want to be able to create a level of confidence in any community-facing communications and efforts. So there's opportunity for us to provide some feedback, make some changes, share our input as those who actually get it, right? Who have that lived experience. Next slide. And then some things that we're excited for and looking forward to. So more of those in progress study updates. Again, we want to maintain the confidence from our stakeholders that things are moving along. We want organizations, individuals that are involved with YACC to know that we really are moving along our efforts with their support. They're not there in the everyday meetings, so we want to give them that assurance. We want to create more community rallying and engagement hosted by leadership team members ourselves. When it comes to community-based work, from my experience, it does make a difference when you meet people where they're at. When levels of engagement is led by and hosted by folks who can speak in their language, who get it, right? So we're kind of toying around with some ideas of hosting, virtual tea sessions where we can share what the latest is in a medium that's different than, for example, email, right? Answer whatever questions people have, whether you're an individual or an organization that might be curious about how to get involved. As I mentioned, other mediums. So we recognize, in the spirit of accessibility and diversity and inclusion, that people engage and respond and connect in different ways. So we want to be able to give people the option, again, in the spirit of meeting people where they're at. And we want to be able to create more opportunities to collaborate alongside more individuals and groups external to YACC. This type of work is not the type of work that we can do on our own. Again, anything that is in it for the long game where it impacts a significant amount of the population does require some collaboration. So we want to understand where organizations are at, where our communities might overlap, and explore how we might be able to work together. again, this work is important because it not only affects those diagnosed with cancer. With regards to YACC, it's that 18 to 40 age range, but those who are a part of their lives, family members, colleagues, communities. At this point, I'm going to pass the mic over to Danny, who will share how it's impacting more of us increasingly, including potentially those who some of you might be working to serve. Take it away, Danny.
So certainly, I'm sure many folks here work with younger populations, and you're aware that like there's a lot going on for young folks right now in this country, in this world, be it from extreme financial pressures to climate change anxiety and really living through the real impacts of that, to mental health challenges. There are kind of like countless things that are pressuring our younger populations. But one of the stories within that might get missed is that cancer cases are also on the rise within this population. So it's been one of the harder parts, I would say, of my own survivorship, from being somebody that was, oh, we've never seen a colorectal cancer in somebody your age in this emergency room before, to it becoming, unfortunately, more and more common. So certainly this research is really important. Something else to keep in mind, while all those headlines are very despairing, is that like young adults are also super resilient, and many folks are in survivorship of their cancer experience. It's so much more than just like what happens in those treatment rooms, what happens in the chemo chair, in the operation room, what have you. It's about life after that. And that's what we're really wanting to make sure we understand how to support people through their recovery. I won't lie, like me exploring the world of social work, like a lot of that was also like, I need to figure out how to recover from this myself. And so I took a really long road there. That shouldn't be the case for everybody. We should have so much information on how to set people up for the long road ahead. And with that, I'm going to pass it on to Pam again, and we can probably go to the next slide. We're just about done.
Thank you, Danny. Yeah, so just as an update on recruitment, we only started in September of last year, 2023. That's when we launched our study, and we have about 550 people that have already completed the baseline survey, but we're looking for 2,000. We want 2,000 people across Canada to share their experiences on what it's like to be a young adult living with cancer. So for next steps, we want to focus on our qualitative research component. So we've already been quite successful in building our survey, kind of the quantitative piece. And now we want to focus on the interviews, the focus groups, the creative methods, things that we would like to have feedback from the community on, so that we can dig deeper into meaningful topics. So that's going to be our next focus for the next year, in addition to still recruiting for our survey and growing our community. So with that, we have opportunities for healthcare professionals to partner with us, so that we can get the word out about YACC programming and Recover, and what we're trying to do to improve programming or offer new programs. So we are still recruiting for the study, so young adults who've been diagnosed with cancer before the age of 40 and are currently above 18 all across Canada. So if you know of somebody, please send them my way. We are happy to share any kind of posters, either electronic or hard copies. We can mail them to you, email them to you. Just please reach out to me so that we can spread the word about this very important study. So with that, I want to say thank you so much, everybody, for your time and listening to us about this very important study. This is our poster. There's a QR code there. We make it very easy for people to hopefully join up and be part of our community and part of the research. And I hope we have some questions. Thank you.
Thank you so much, everyone. Danny and Jeff and Elisa and Carolyn and Pam. It was wonderful to have so many of you to speak to your different perspectives, and really hear this journey of how the Insight team was able to really initiate, this research, drive the research from the very beginning, and how the recovery leadership team has been really able to drive that research as well. So you can see the really strong community-driven and participatory aspects of this. So I encourage folks, please enter any questions you have in the chat box for the presenters, and we'll try to get to as many as possible before we wrap up in about 10 minutes. And I have a question just to get us started. It really intrigued me, Carolyn, you were speaking about, the importance of meeting people where they're at and how some of your different efforts are trying to do that. I'm wondering if there's any specific examples from the Recover study of when you do that, maybe how you tried to engage the young people in the research by meeting them where they're at. Is there anything you did specifically to try to get that engagement in your research?
Just want to make sure I'm off mute. Yep. Thanks for that question. I think even given the fact that the leadership team is compiled of folks who get it, gives us already a bit of a significant stepping stone, right? And I think those 7 of us and folks on this call are very aware of the fact that everyone's experience is very different. However, there are some themes, right? There are some common themes, and just by the way that we've designed their leadership team gives us a start, right? So I think first and foremost, who the leadership team comprises of, I think, makes a significant difference. I think that everything from the who, what, when, where, why of the delivery of communications, that getting a bit of a pass or an assessment and feedback collection before it goes out, I think is really helpful. I also think that in general, and this doesn't just speak to YACC, but there are specific needs and specificities within certain populations or subpopulations and communities that exist out there. And sometimes I think that we can almost overexhaust ourselves in trying to really understand what this community needs without having that lived experience, right? So, for example, if I'm trying to really engage in the rural and remote community, city girl here, born and raised in Toronto, right? Sure, I could read all the books, go to all the webinars, sit with folks who live in those communities and try to upload all of that contextual information in my brain. Or I could partner with those who already have existing relationships in those communities, who are from those communities, because the delivery of whether it's communications or programming will have those undercurrents of context that even myself, if I spend decades of years of experience studying, I'm never going to get a complete grasp on. So that's where collaboration is key. Collaborating with other community organizations who have a specific relationship with communities that we might want to better serve. I hope some of that helps. I just sprinkled a few your way, but.
Maybe
Thank
I'll
you.
jump on there as well and just give another really tangible example, I think, as to how we've met people where they're at. And one of those ways has been through language. I was less involved in this part of the program, but Kareen, who's also in the chat there hiding, is our program director and took a great amount of care and effort in really leading the charge for this study to also be available in French and for it to be a very thoughtful integration of French language. So sure, you can throw things through Google Translate and see where that gets you, but especially in the world of cancer and oncology, and the words that we use to describe are very, very, very nuanced and carry their own weight. And so there were measures that had not been validated in French that we went to the efforts of validating. We did focus groups with French community members to make sure that here's how we were asking this question. Here's what we intended for it. Is that coming across in this new translated way? And that was another way to make sure that we were getting as much as we could feasibly do to bring in a broader picture of this country. So one way to meet people where they're at is certainly language and thoughtful examination of language.
Thanks for sharing that example, Danny, and thanks, Carolyn, again for everything you were sharing there. It's neat to hear how some of these principles that we think of when we do think of program design and delivery can also be translated into research principles for strong research engagement. Well, thank you both. I'll jump to the first question that came in the chat here from May. May has asked, what is your plan for keeping the leadership team involved in the analysis as well as the knowledge mobilization pieces?
Great question. I can take that one. So as mentioned before, we've just started meeting in January. So there's a lot of things that are in discussion and that are on our future agenda items. At this point, we're discussing what the analysis and knowledge mobilization plans would look like. We actually have our next meeting on Friday. So that is one of the things on the agenda. What are the important aspects in terms of analysis that we should focus on? What are the questions that we really want to focus on? So we will discuss that on Friday. So that's one of the ways that we're engaging the leadership team to really hone in on what's important in terms of what we share first in the community, because we're not going to wait until the end of the study to share information. We really want to share it as it comes to us, with the community. So in addition to that, the leadership team will be pivotal in developing the materials and anything that's going to be like forward facing to describe what it is that we're measuring.
Thank you for sharing, Pam. And I think that also starts to answer the first part of the next question that came in about what are your hopes for disseminating research results and implementation? Is there anything anyone would, I guess, add to that question there?
Sure, I can jump on a bit there briefly. So one of the, I think, the strong benefits of like YACC leading and owning this research is that we are already serving and actively engaged with this community. So we can take things when it comes to like that knowledge translation gap that we so often hear about, that I think is like often quoted around like 18 years, like an enormous amount of time. We can really cut much faster to our community members. And I think part of what's been really wonderful and what will make it really easy for us to do this is something that we're already invested in doing. I think that was true for Prime as well. We talk about recovery all of the time. We talk about mental health. We talk about psychosocial impacts all of the time in our programs that aren't necessarily under a research banner. So it's really easy for us to talk to these folks. They're in with us. They're a part of community and they're helping to shape all of this. And so it's going to immediately go to infusing within our programs. It's going to show up at be it like peer chat conversations that we have together, looking at like, hey, here's what this number says. How do we feel about that? What do you think about that? To showing up in conference presentations to our community. Like we're able to like, I think our first priority is bringing this information and using this information effectively for our community. It's going to be really cool when we get to publish some other stuff and we get to talk to medical professionals about it and all. That's all really cool. It's not on our list of things to do, but it isn't our first thing that we're going to do.
It's a neat perspective you have as in a way, you are a service, like a direct service organization. You provide services and programs to a population, and doing the research yourselves means, like you say, you can immediately use that research to adapt the way that you do things. And as a national organization, that might also be kind of setting a standard or an example for others as well. So that immediate use of the findings.
Yeah, it's that immediate feedback loop, right? It doesn't just go into the void and there's question marks. It's like, okay, what, again, my background comes from like not program creation must be evidence-based, right? Like, it's like we don't launch anything until we have some proof in the pudding, right? So again, because YACC has worked so hard over the past years in cultivating that community, there's that trust level, right? Which is huge, right? Especially when you're working with a population where they might feel underrepresented, underserved, right? So it's that immediate feedback loop that YACC is able to achieve.
That's great to hear. Thank you for answering that question and the previous question as well. It's great to hear that, it sounds like, again, the study was really initiated by the insight team, or the ideas from it were crafted, and you're going to continue to have that insight team and the Recover leadership team really crafting what knowledge mobilization happens and how and what needs to happen first, that prioritization. So we have two other questions that have come in that both kind of touch on this idea of different populations or demographics. So there was one question about whether you'll be exploring perhaps different needs for different age groups of young adults. So in your research, do you do any differentiation, kind of subdividing the population?
Yes, we certainly will. We're collecting age, current age at diagnosis, and because there's no upper limit of the people that we are enrolling. They just have to be over 18, just because that's our population that we serve. We're hoping to get a wide range of ages and then age since diagnosis, so that we can really compare differences on like the age of diagnosis or the age since cancer diagnosis. So that's definitely in the works to analyze those differences in between groups.
Well, thank you, Pam. And that touches on the next question as well. The next question talks more about differences between type of diagnosis. So Denise had shared, it sounds like your research is taking a transdiagnostic approach where you're looking at commonalities amongst the different subdiagnoses or populations, but was wondering as well if there are differences between different cancer diagnoses or demographics and how you might navigate documenting or reporting on those differences.
Yes, definitely something else that we're measuring. Like Denise had said, yeah, it's more so the young adult cancer experience, not necessarily because of the type of cancer. But we are collecting the type of the primary cancer that people have been diagnosed with, so that we would do some kind of analysis to compare between cancers, just like ages as well. But we are more concerned about the young adult cancer experience and how we can provide resources and hopefully improve the quality of life of young adults, regardless of the type of cancer.
And I just want to jump in here. As a young adult living with a very rare diagnosis, if it weren't for YACC to have a community where, any stage, any cancer, YACC has your back, I really wouldn't have anywhere to fit in. There is some cancers that do affect young people at a larger proportion, but there's also many young adults who receive, what's considered a very rare diagnosis. But our experiences do mirror those of our colleagues, well, our peers who have maybe a more typical diagnosis. And this is one area where YACC is really instrumental, especially in the Recover study.
Elisa, I love that you bring that forward. Like, we're a disease agnostic organization. I think that brings us so much strength. It's so lovely to have all these different experiences come together, but to find these common themes. But that said, the more people we're able to enroll into the study, the more be it sub-studies, what have you, that we can do, or if it's okay, wow, we've had, let's say 400 folks that have been diagnosed with breast cancer come to this, that gives us a little bit of extra information to play with and maybe be able to say some things more specific to that population. Another kind of aspect that was noted within there as well was around prognosis, or sometimes we talk about stage, there's lots of different ways to kind of approach this topic, but for YACC as well, we aren't only measuring what's going on with folks that are finished treatment, let's say. There are so many folks, more and more these days, that are living with cancer in more of a chronic way. That stage 4 means, yeah, I am living with this disease. I am continuing to go to my immunotherapy appointments, let's say, or I'm doing watch and wait, or I'm continuing to try different lines of chemotherapy trials, what have you. We are still very, very interested in understanding this broader concept of recovery when it comes to folks that may be living with cancer in a very longitudinal way. We believe that it is possible to continue to heal and recover from these very difficult and often traumatic experiences, even as we're still experiencing them. And so that's something we're very interested in as well. So if you're oh, I have somebody in my network that I would send this to, but they're living with a stage 4 disease, or they're actively in treatment, we still really want to meet those people. We still very much want to understand this kind of new frontier of living with cancer.
Thank you for sharing all of that, both of you, and bringing your own personal experiences into that as well. It does sound like it's such a strength of a research like this. I mean, instead of looking at differences between communities, it's almost a bit of a strengths-based approach to say what are the commonalities between those experiences and what's that impact on quality of life. So thank you so much for sharing that. And I see, Corrine, one of your other staff members had shared in the chat, in many ways, recovery starts the day you receive a diagnosis. And I think, Danny, that captures what you were speaking about there. We are at 12:59 Eastern time, 1 minute left, so I will quickly wrap us up. Thank you so much to our presenters, to everyone that asked a question, participated in the chat, everyone who is sitting back and listening as well. We have been recording this event, and we do post all of our event recordings and slides on our website. My colleague Ali has posted in the chat where you can go on our website to watch this and other past webinar recordings. Feel free to share this with friends and colleagues, anyone you might be interested in watching. If you would like to stay in touch with us, perhaps join us in future e-learning events or learn more about our network at Community-Based Research Canada, you can sign up for our newsletter, and my colleague Ali will put that link in the chat as well. Lastly, I had mentioned that this was the final event in our series on young people and community-based research. We do take a break over the summer months of July and August, but starting in September, we have a brand new 10-month-long, year-long series where we'll be exploring how community-based research can respond to the current crises of today. What is the value of community-based research in responding to the crises that we face? So we'll be tackling a lot of the topics from the social development goals, things like social inequities and oppression, climate emergency, housing, hunger, poverty. So stay tuned for our wonderful list of presenters and events that we will have in that series beginning in September. Thank you so much, everyone, for joining us today. We will sign off now, but one last moment of gratitude for everyone who has joined us, and of course for our presenters and the wonderful work that your team has done on the research study. Have a wonderful rest of your day, everyone.
Thank you, everyone.